Good afternoon, class. Ed Boylan here, and we're talking today about the hemorrhage control skills. We have with us our EMT jump kit, and in it, it's going to have everything you possibly can need on any basic call that you're called to. As items are used from our jump kit, and this is on the one from engine 6, and we have them on all the other engines, then you would always make sure that you replace any items that you might have used on any call before. And so today we're going to be using the bag, and a call is going to be dispatched to a 70-year-old male who was found on the floor in the bathroom by his wife, and he's bleeding from his right arm. So when we get dispatched to the call, we're going to make sure that we have the appropriate PPE on, that the scene is safe, and the scene is safe. So we're going to do an examination. Now we find the 70-year-old male. He's sitting on the bathroom floor. He's leaning with his back up against the bathtub, and he's conscious, but not actually alert. He's not completely unresponsive, but he's not very responsive to any of our questions, and he's not being able to tell us exactly what happened. So when we expose his right arm, we see that there is blood, and it's soaked on his pajama bottom, on the bottom part of his arm. We see that he has a laceration, significant laceration, right near his elbow. His wife tells us that the patient has been suicidal for the last couple of days, and she thinks he probably acted on it. So what we're going to do is we're going to take out, the first thing we're going to do is apply direct pressure. And we're going to take out a 4x4. We're going to apply the direct pressure to the arm. And if that doesn't stop the bleeding, then we're going to take another 4x4 and we'll put it on again. And we'll keep doing that for as many times as we have to in order to stop the flow of blood. If that doesn't stop the flow of blood, then the next alternative is to apply a tourniquet. So what we're going to do is use this tourniquet, which is the tourniquet that's in all of our trucks, and we're going to apply it in the appropriate position. Now, where we normally would apply either on a lower extremity or an upper extremity is the furthest point away from where the laceration or the cut is. In this case, since the laceration is here, we're going to apply the tourniquet further up on the arm, right near the shoulder. So we're going to apply it all the way up. And unfortunately, for the sake of the class, we don't have the mannequin that we would normally have to do this. It's being lent out to another department, so we can't do it. But what we would do is we would apply it all the way up to the top of our arm, and we would take the crank and we would continue to turn it and turn it and turn it until we achieved the stop of blood flow. And we would lock it in place as we do right here. And then we would wrap the rest of this around to keep everything in place. We'd mark on the outside here the time we applied the tourniquet and that it was properly positioned. We're going to make then at this point, once we have stopped the flow of blood, we're going to put some high flow O2 on the patient right away. And what we're trying to do is stop any shock from beginning to set in. So we're going to make sure that we also put on top of the patient a blanket. We're going to lay him back and we'll get immediate transport. This isn't anything we're going to mess around with. We're going to want to get him back in the rig as soon as we can and get him down to the hospital. And then once we do that, we're going to, if luckily for us in our situation, we're only about 5 minutes from the local trauma facility. If in some cases you weren't, if you were out in the field, remember that you want to keep a tourniquet on only for maybe an hour and a half and then release it, because we don't want to stop the complete flow of blood and circulation throughout the arm. For a short period of time, it's fine, but for a longer period of time, we can do damage to the hand and the lower part of the arm or the lower part of the leg, depending upon where we have it. So make sure that if you are going to be for a long transport, that we release it and let the blood flow for a little bit for every hour and a half, every 2 hours, just to make sure that we have it. And then you've completed this application. So what we're going to do in the next couple of minutes is we're going to try putting the tourniquet on each other. We're going to see what it feels like. Please don't turn it all away. We don't want to stop the flow of blood, but we want you to get the feeling that it is painful for the patient. And you need to tell them that before you apply it, if they're conscious, that it will cause a little bit of pain. If you have any questions, please let me know.